What's up, you guys? It's Boy Miguel giving you your daily dose of radiation. In today's video, we'll cover how important is it to get all the anatomy and sometimes a little bit extra during x-rays. So to give you some credentials, I'm an x-ray tech, been pushing the button for 4 years. Night shift / OT game, a lot of OTs. I do work day shift a lot. So as far as how if they order a chest x-ray and you take it, and essentially a basic chest x-ray involves all the way from the apices all the way, the apices of the lung all the way to the costophasciate angles, the low tip of the lung. Technically, that is 10 ribs, inspiration, whatever. That is all you need to get you won't get in trouble because that's all you got. But if the patient is complaining, sometimes they'll order a chest x-ray to view everything, and then they'll also put upper abdomen pain. It wouldn't hurt to just leave, especially if they're smaller patient, to leave it open a little bit to get part of the upper abdomen, because sometimes certain patients, depending on what they have going on, you may see air fluid levels, or you'll see something that could be missed during the stuff, and especially with fractures. Let's say someone fractured their wrist, right? So usually with the wrist, you x-ray, so about right here all the way to right here, okay? As an x-ray tech, you're not supposed to tell the patient what you see. You're supposed to see the pictures, make sure all the bones there. But if you see a crack that goes on a little bit higher or a little bit lower, you should kind of open it up to get a better thing, because with time you'll kind of know, okay, if I make sure I get a little bit more, it'll prevent you from having to go back and let's say getting a full forearm because the rat cyst, the crack continues on. Certain stuff, with time you'll kind of pick it up and you'll understand, to save you from having to come back or having to shoot multiple to reduce dose, especially if it's a little kid. You don't want to go and have to come back and x-ray several more when you could have reduced the dose by just opening it a little bit more. Now, granted, certain stuff depending on your hospital, may need different orders depending on how high you go, because I know certain views or certain stuff, if they have hardware and stuff, may go a little bit deeper or longer. So that kind of all depends with time, and the doctors and all that will kind of give you a gist if you need a completely different order set for certain exams and stuff like that. So I would say that's a situation. Sometimes if a patient got shot or has fractures and you'll see the bones kind of got you may want to open it and make sure you get everything. Or if there's a bullet, make sure you open it all the way, get all the soft tissue and everything to make sure the bullet's not there, or they can see where the gun, the bullet got out. That's sometimes something that's important. Or if a kid swallows a penny or something and you shoot a chest x-ray and abdomen, you may want to open it a little bit more and get a little bit of the neck, because sometimes it gets stuck there. So certain stuff with time you'll kind of understand when it's okay to have a little bit more exposure, a little to reduce the thing. Because if you x-ray, let's say a chest x-ray, and for most kids, if they're looking for a coin, what will happen is they'll order a chest and abdomen. Okay. If you shoot the chest x-ray and you collimate it really tight and you didn't see nothing, and the coin is right here, and then you go to shoot the belly and it's not right there, If it's like right here, and if you would have opened it, you could have prevented like the kid from getting a full KUB because like you opened it up a little bit more. Or sometimes even asking the patient like, where do you feel the thing? I know sometimes with little kids it's harder because they're little kids or babies, but like certain stuff like that could help you prevent getting extra radiation dose. It's just stuff with time it'll come where it's important to get a little bit more of the anatomy than is kind of do learn in school. Yeah, it's been Miguel. See you on the next one.